After I got that injection, what happened was I wasn't really able to even walk or stand for more than like 3 minutes. And so it's super hard, like just standing for any sort of meeting, I would have to sit. Walking, I could probably walk like 200 yards and then I would have to like sit because everything was in such like terrible pain. My name is Shao. I am 35 years old and I am a software developer. I came to Upright Health because I injured myself playing basketball. I play basketball a lot. I also do a lot of running and have generally been very athletic up until a couple of years ago when I hurt myself. So about 2 years ago, I was playing basketball and I was just going up for a normal jump shot, hurt my back. I pulled it really bad, so much that after the game I actually had to lay down on the ground, couldn't really get up. After that I went to the emergency room right off the bat. They claimed that I actually fractured my vertebra, which turned out not to be true. But that kind of set the tone for my experience with different doctors. I actually switched healthcare providers right in the middle as well. And actually it got a lot worse throughout the days as well, where my back, I just couldn't actually sit for any amount of time at all. Walking around was a big pain in the butt, and I also had a kid around the same time too, and so it was just a terrible time for me, where like every day was in a ton of pain, lots of painkillers every day, and I actually saw probably about 4 doctors total, all of them giving me varying stages of advice, but all of them geared very much towards, we'll start with some physical therapy and then you're going to go down this chain, eventually leading to surgery. At every single one of these doctors, I would get an x-ray. It did, say, oh, you might have a little bit of scoliosis here and there. But then as my problems kept progressing, eventually it led me to getting an MRI, where, we wanted to see if there was any disc issues or anything like that. And I believe my MRI showed a disc herniation at the L5-S1, and a little bit of a protrusion on some other thing. But they were all claiming that because the protrusion was on the right side, which is where I was really experiencing the pain, that's where the surgery would happen, and all that stuff. This was right after a bunch of Golden State Warriors news about Steve Kerr's botched surgery, and so I was very hesitant to go down surgery, so I was like, yeah, I'm going to do all this physical therapy, get right back on track, and I'll be back on the basketball court. I actually went through a couple of different sessions. So my very first session was right about 2 weeks after my initial injury, and so it was very, very basic, but getting me back up to speed. So I would actually visit every 2 weeks for a grand total of I think 8 weeks. And so at around like the 6-week mark, I started to plateau, but I didn't think anything of it. And we continued until the prescription ran out. And at that point I thought, yeah, I'm doing better. It wasn't fully healed, but I thought that I could actually make it. But then it just kind of stopped progressing. And so no matter what exercise I did, I was just kind of stuck at a particular level. Once I switched providers, I never really saw any improvement there. But because it was kind of subsidized and it was so easy, I went to that for probably around 3 to 4 months, just kind of not really progressing, doing all the different exercises that they would prescribe, but it just showed no improvement. So after I stopped progressing, I went back to the doctors and they prescribed me an injection in my back, in the lumbar spine. So I got that, and I believe it kind of helped. So it did, at least psychologically, helped me think that everything was getting better. And I did experience some lower amounts of pain just sitting around. But the problem was after I got that injection, what happened was I wasn't really able to even walk or stand for more than like 3 minutes. And so it's super hard, like just standing for any sort of meeting, I would have to sit. Walking, I could probably walk like 200 yards and then I would have to like sit because everything was in such like terrible pain. After the injection didn't help, they wanted to actually inject me again, at which point I was very hesitant because of the walking issues and the standing issues that had arisen before. And so the next step that was given to me was, okay, if you don't want to do that, your next step is consult with a surgeon. But at the time they also said, yeah, surgery is probably a 50-50 for you because you've been injured for so long that your chance of fully recovering is a crapshoot. At which point, that also was another nail in the surgery coffin for me, where I was like, no, I'm not sure I want to do this, especially if it causes more complications and all that. And I'm super thankful that I didn't actually go through with it. Usually my mindset in anything like athletic at the time was just push through it, just do what like Kobe and everybody does. And so I would continue trying to work out, and I would have a lot of setbacks. So I would work out, do a bunch of exercises. I would see a little bit of improvement, and then I would pull something, some little thing would happen. I remember one very specific time I was just climbing the stairs and my foot slipped, and I was literally in like dying pain for about 2 weeks, where I actually had to call my HMO provider, get even stronger painkillers just so I could get through the workday. At work, I was actually laying on the ground as well with my computer up. I was searching every single thing. I read all the different books about back pain, just trying to find like the one magic pill that would kind of solve everything. And so I was going on YouTube. A big frustration of mine was that on YouTube, like you would kind of see one exercise video that was like, do this and it'll help your back pain. You would see another one that says, never do this, you're gonna destroy yourself. And so it was really, really difficult to actually know what was going on. And so it was a very frustrating experience one day until I stumbled on Upright Health's YouTube channel. What I think the most important thing that Upright Health provides is the level of expertise and knowing what I'm doing is actually helping, or knowing why I'm doing a particular exercise. And so it's a very interactive session. All of our sessions are very physical now. So I do leave here with a big head of sweat, and I do feel like I'm actually progressing every single time I come. I'm always learning some new exercises. If I feel like something is really tight, I'll kind of be able to, because of all these sessions with Trevor, I'll really be able to decide whether I should be stretching in a particular way, whether it's actually going to be attacking the weak point in my muscles, and all that good stuff. Before I was injured playing basketball, I was a fairly avid player. Once I got injured, I literally took a 1.5-year break, where I would try to go back to basketball, but then as soon as I did, I would immediately hurt myself. Just like even not non-contact, just like running around, I would feel the pull and I'd be like, that's it, I'm bedridden for 2 more weeks. After I'd done some of these exercises and gotten a lot looser, a lot more flexibility, I started slowly ramping back into basketball. I was playing one-on-one on a bi-weekly basis. This was probably after about 3 months of every 2 to 3 weeks coming in, really working on a lot of my weak points, up to the point that about 6 months in, I was able to really fully play a 5-on-5 game. Before my injury, I would always have back tightness after playing basketball. But now when I play, that tightness is even gone. The effect on my family life has been huge as well. Before, when I was actually very hurt, I couldn't carry my kid as like a toddler, or he couldn't even really walk. He was an infant at the time. And so it was super difficult. I would kind of put all the responsibilities on my wife to deal with all that stuff. And so it caused a lot of stress, in my daily life. Just existing was, a very painful experience. But now that all this pain is kind of gone, I'm a lot stronger in a lot of ways. I can actually like throw my kids. I'm never really worried about it. They'll sit on my shoulders. All the crazy like positions that you can possibly get into with a toddler, we get into. And he's also a lot bigger now too. So I never feel any sort of pain from any of these things. And it's been a total, 180. I think the last thing that I would say is, no matter how deep or ingrained your pain feels in your life right now, that you have the ability to really work through it with a couple of exercises, strengthen the muscles that are weak, and your life will totally change. Pain sucks, life shouldn't.